I'd like to demonstrate how to draw blood to get a blood specimen. I'm sure everybody has to go for blood work at some point of their life if you haven't already. So I'd like to show you how easy it is and painless. You can be more aware of what steps need to be taken, make sure they do it correctly, so there's no infection. So first I'm going to show you some materials that I'm going to use. And I made a little board here. I'm going to use a Vacutainer safety needle, or you can use a safety butterfly. I prefer the safety butterfly. Very easy to use. When you're putting in the tubes, it's a lot easier to handle because you have some play with it being in the patient's arm and putting your tubes in and out. It's also a smaller needle. It's less painful. Obviously, we're going to use some kind of swab to clean the area. Our tourniquet. This is our sample container. A gauze pad, a Band-Aid, disposable gloves. The biohazard bag is if you're sending the specimen to a lab, taking it in the hospital, and that's what I do. Here's a few little demonstrations on how to tie the tourniquet, just in case you can't see when I do it, and also what veins we're going to be looking for. We're going to be looking for the cephalic vein, the basallic vein, and the median cubital vein. So I'm going to ask somebody in the audience if they would like to volunteer, and I'm going to draw your blood. All right, sir, come sit over here. Okay. So we went over our equipment check, which is on here. This is finding a vein and inserting the needle. And then drawing the blood specimen, covering the site. So first I'm going to, well, if I was working in the hospital, first I would identify the patient. He would have a name bracelet on here. I would also have a sticker from the nurse, and I would just identify the patient to make sure I have the correct patient. Then I'm going to tie the tourniquet tightly 3 inches up from the site I would like to draw from, and I put it in, if you can see, like this. So if there ever was a problem, I would just pull really quickly up and the tourniquet would come off. You don't want to leave the tourniquet on more than a minute, so I'm just going to prepare the things that I need. So again, I'm using the butterfly needle, and when I use the butterfly needle, I have to attach it to my container that's going to hold my blood specimen, like that. I also just got my little cotton swab ready, open it up. Now you can use a Band-Aid after you draw the blood, or in the hospital we just use a little swab like this. I fold it in 3s, I prepare it in 3s, put a little piece of tape on it like this, and I just stick it on the table next to me so it's ready to be applied. Then you put your disposable gloves on. You always must wear your disposable gloves. Okay, so I'm going to tie the tourniquet. This is a specimen tube to put the blood into. So now I'm just going to look at the veins, palpitate a little bit to see which vein I would like to use. Now, if you can see, this person has what I would call juicy veins. They're amazing. Very easy. So I'm going to clean the area in a circular motion. No. I'm going to pull the safety off the needle. Now you always want to have your needle with the bevel side up, which I know is hard for you to see. And we're just going to insert the needle into the vein. Now with the butterfly needle, you get a little flash, so you know you did get the vein. Now I'm going to insert the specimen tube in. And we are, getting blood. Okay, so now when the specimen tube is full, I'm going to take it out and rock it. You rock this so there's no clotting. Now next to me I have my gauze. I just have to apply it on there. There's a little button that pushes the needle inside so we don't get stuck. I apply my gauze, pull my tourniquet off, and now I have a fresh blood specimen. So now I'm going to take my label, again identify it with the patient, put my label onto this vial of blood, and I'm going to place it in a bag just like this and send it off to the lab. Take about 45 minutes to an hour to get some results. And that's how we take blood. Thank you.